The Jameson Classic has been the #1 fundraiser for our Jameson Health Care Foundation for over 20 years now. And it really helps us to allow the community to demonstrate its support and its belief in Jameson as a valued asset for the residents of our community.
The Jameson Health Care Foundation board is made up of community, the members of our community who live and work in our community, who believe strongly in our health system and believe strongly in keeping care local. And what we do, we get that message out to our people. We get it out to the community, we tell them the needs of the hospital so we could improve the health care in our community to make it better. You know, technology is so expensive today. The cost of everything is going up, reimbursement rates are going down. There's such a demand on our health system today that it's not able to sustain by itself. And that's where our community comes in, and that's where we come in. We come in and we deliver that message to our community. We educate them. We tell them what we need, what we have to do in order to keep the healthcare local. We tell them every dollar you give our community, every dollar you give our hospital is a reinvestment back into your future as well.
Across the country, our society is aging, and Lawrence County is no different in that we have an aging population. And as it turns out, cardiac disease and chronic diseases tied to cardiac ailments is one of those things that becomes more and more prevalent. And that's the purpose for us dedicating the 23rd Jameson Classic to help assist in the development and growth in cardiac services.
We have a phrase that says, time is muscle. And so for one of the services that we offer, a cardiac intervention program, and looking at our door to balloon time, which encompasses walks across many departments, getting that patient right at the front door in the emergency room, up to that cath lab, and the physician getting that artery open in less than 90 minutes is crucial, because getting that artery open offers better blood flow and minimizes the amount of damage that can occur in the heart, which is better outcome and decreases the chance of dying from a heart attack.
It's just nice to know that whenever we work together, from the nurses to the physicians to the care managers, the nurse practitioners and physician assistants, that we all work together, do what's best for the patient, and work towards that one outcome, which is predominantly giving the best care to the patient.
You can tell, because as you're watching this, even though there's a lot of hustle and bustle and there's a lot of people in the room, no one seemed to get in anybody's way. And so, you know, there's an efficiency and effectiveness there that is very apparent to me anyway.
I mean, we have a very good group of nurses and technicians here in the cath lab. They're experienced. Almost all of them have been doing this for quite a number of years. They're very good, they're very dedicated. They come in quickly, they take care of the patients, they deal with the families well.
When we work together and talk together and share our expertise, you can provide care at a level that people just are not used to having, and really at an exceptional level, and the level that people deserve.
I think the key to that is communication. Myself, Dr. Armatorio, Dr. Pacone are in constant communication with each other. Somebody is in the office, somebody's in the hospital, and that is probably the most important aspect to care of patients, communication.
The way I always explain to it is my patients is there's general contractors, there's plumbers, there's electricians, and they fix different parts of the house. So Dr. Wodzinski and I are general contractors. And so we're good at sort of looking at the whole picture. Dr. Armatorio, though he does a lot of the stuff that we do, also is an expert plumber. In fact, he's one of the best. And the ability to have somebody of his quality and expertise in our local community hospital cannot be underestimated and understated. It's absolutely fantastic. And it just shows you what you can do when you have strong people who care about a community, who want to work together.
I think the advantage that we have here is that we do work closely with UPMC in Pittsburgh. I go to Passavant and Presby several times per month and work down there. So we have a close relationship with them and the ability to consult with them, and if there's any questions about what is the best way to treat a patient, we certainly have the ability to make those decisions pretty quickly.
And so I think it's a unique situation in that you have 3 people from a small area who are all passionate about helping the people in that area. Our parents are here and our families are here and our children are here. When you have doctors that care about the community and care about the people that they take care of, it takes care to a whole new level. But ideally what we want to do is provide very high quality cardiac services to people who are here and be able to help those people if we feel that they need an advanced service that can be provided in Pittsburgh.
Obviously, as physicians, we always want to provide the best care we can to our patients. But I'm a little biased when you live in your community and you're from your community. I think that you put a little extra effort in.
I'm so proud of our staff because they focus on what they do best. They focus on taking care of our patients with compassion, attitude, respect, and excellence. They focus on providing the best care to our patients in our community.
We see a plant, but the root system is down to here, and people don't see the root system. And this is the whole community down here. You know what I mean? Jameson might just be the plant up here, but that root system is here, and that involves all of us.